Dr. Jason Wang is the director of the Center for Policy Outcomes and Prevention at Stanford University. Now, he says the use of disinfectant sprays helps people psychologically, but has no real benefit.
I think a massive spread of benzalkonium chloride probably would cause more harm than good to the population. One of the things that we know about this chemical is that it gets to the skin, so it could cause skin irritations. It gets to the lungs, so it could slow down the ciliary motions in the lungs, and it could, in some cases, lead to asthma. And some of the cases also show that it could affect the eyes. And so I think it's probably more psychological than actual benefit to the population. Now, if one were to use this chemical, maybe in a more targeted area where you avoid the crowds, for example, in decontaminating a hospital room where people could be touching the surface, I think that makes more sense than a massive spread in the population. And finally, I would like to comment that personal hygiene is very important. So, teaching people to wash their hands and avoid touching things, touching their eyes is probably more effective than a massive spread of a chemical.